without further ado, let's get into this Health Canada authorization of the novel mRNA booster. Now, Drea, I suspect that you and I will want to go off a little bit and not be censored by YouTube's community standards. So I propose to show this first clip where they make this announcement and tell Canadians to watch out for misinfo, because that'll be great to keep on YouTube. But then after we play this clip, we're going to switch over to some of those other platforms, Rumble, Odyssey, and Getter. And we're going to continue the conversation over there. What do you think?
I think that's the wisest choice.
All right, let's play that first clip and then we'll come back and chat.
Mask on. Health Canada continues to use rigorous and independent scientific processes to ensure all health products meet our stringent requirements for safety, efficacy, and quality before allowing them on the market. And as with all of Health Canada's vaccine and drug authorizations, we want to stress that we only examine the most robust scientific evidence from trusted and reliable sources. We recognize that there's an abundance of information available that's sometimes false and exaggerated. We encourage people to consider their sources of information very carefully. As we did with all our COVID-19 vaccines, we're publishing a number of documents about this decision, including the Canadian Product Monograph and the Regulatory Decision Summary, which provides a high-level summary of the evidence that we reviewed. All of this information is available on the Government of Canada's main COVID-19 website. Health Canada and the Public Health Agency of Canada will monitor for any adverse events in collaboration with the provinces and territories, international partners, and manufacturers. As with all vaccines, we will take action if any new safety issues are identified. Today's authorization provides people in Canada with more protection against COVID-19. I know we all wish COVID-19 no longer existed, but people are still getting infected, and vaccination continues to be one of the most effective ways to protect ourselves against serious outcomes, including severe illness, hospitalization, and death. Vaccine protection decreases over time, which means many of us are due for another dose. Receiving a shot of the new formulation will help protect people against the variants circulating currently and expected to circulate through the fall and winter.
They just rubber stamped it, and this authorization, this interim order authorization that was basically pivoted to just be a permanent part of the pharmaceutical approval process, doesn't uphold the typical checks and balances that were previously in place to bring these products to market. You have to be so mindful of the words that they use. They're still using authorized. That's authorized under that interim order that was pivoted after 1 year of being implemented to be essentially permanent, a permanent process. And it's based on rolling submissions. The pharmaceutical manufacturer can continue to submit safety data on a rolling basis. So literally while it's ongoing, while it's being conducted, they will submit the data to continue the authorization. This isn't a full approval. And we've seen that repeatedly where Health Canada basically just follows suit with other jurisdictions and gives their rubber stamp. And sorry, I should clarify that if we're not off of YouTube, I think that we should cut YouTube and just go to those other platforms so we can speak freely. So please join us over there if you haven't already. And so I did a quick written piece here, just throwing to the fact that Health Canada has just authorized these novel boosters. And that person that you heard, that masked individual, it was funny, their press conference, I think there was 5 of them. They were all socially distanced, sitting 6 feet apart, wearing their masks inside. They would take them off to speak and put them back on when they were done. And so that particular individual is Supriya Sharma. She's the Chief Medical Advisor at Health Canada. And they're going ahead approving the Moderna Spikevax Omicron XBB 1.5 subvariant specific booster for anybody aged 6 months and up. And so they're also going to be moving to do the same for Pfizer and I think Novavax as well.
Yeah, go on.
Yeah, so I'm planning to do a more robust report on this. But I wanted to throw to a report that I did just a couple weeks ago. And I question, why you should think twice before you go out and get a COVID booster. And it really
Booster
has to do.
on now. Well, do you know what number we're on now? Like what you're supposed, if you're an adult, what number you're supposed to have now? Because I
Well,
stopped
so
counting.
there was the this is the third booster that's different. So there was there was the original dose, and then there was the booster dose that was tested on 8 mice. And now this one is a different booster that's specific to Omicron subvariants. So you had the original COVID vaccines, and you had the Omicron specific one, and now this is an Omicron variant specific one. And maybe actually before we get into this other piece, they're actually not going to be intentionally not calling them boosters anymore, because it will be just an annual or maybe even a biannual injection that you have to receive.
Yeah, and it always isn't a booster anyways. It's always just another shot. Like, I don't even know why they're not boosting. It just didn't work, and you're getting it again.
Yeah, if we have that clip where I think it's Tam says that they're intentionally not calling it a booster. Yeah, I hope this is it.
No,
with today's authorization, NACI is reaffirming its guidance on the use of COVID-19 vaccines this fall. NACI recommends authorized age groups get an updated COVID-19 vaccine dose this fall, 6 months after the last vaccine dose or infection. We will have enough supply of the updated COVID-19 vaccines to support immunization programs across Canada. The Omicron variant continues to evolve, with XBB subvariants such as EG.5 continuing to circulate in Canada and globally. Canada has also reported 11 cases of the Omicron subvariant BA.2.86. This improved immune response is expected to better protect against the strains that are circulating in our communities. It has been more than 6 months since your last dose of COVID-19 vaccine or your last infection, your protection from the virus may have waned. Receiving a COVID-19 vaccine dose this fall with an updated formulation is expected to increase individual protection against infection, symptoms, and severe disease. This is particularly important for people at increased risk of severe outcomes, such as people 65 years and older, individuals with underlying medical conditions, pregnant people, and those living or working in congregate living settings.
Pregnant people.
Vaccination in combination with personal protective measures are integral tools to reduce the negative impact of respiratory illnesses. This is especially important as we head into the colder months, when people spend more time indoors and the risk of respiratory illness increases.
Yeah, that wasn't the specific clip about boosters, but regardless, there's a lot that you can pull out of that. First and foremost, I note here, as the virus continues to evolve, that is literally virology 101. That's what viruses do. They mutate and they become less virulent because they don't want to kill their host. If a virus kills its host, which it needs to survive, then it dies too. So that's not what viruses do.
Right. And of course, people who have comorbidities are more likely to die because the virus obviously didn't know what was going on. So, I mean, whoever came up with the idea of making variants famous, which is what we've done over the last few years, is a genius for Big Pharma. It's such a big money boosting thing. I am glad that the last time I looked at it, which granted was probably a couple of months ago, the uptake for kids getting these vaccines in Canada was extremely low. I don't think that it's going to go up. So we have that. I'm noticing, and let us know in the comments if you're noticing this too, with your loved ones, with your friends. I'm noticing a huge difference in the attitude towards these vaccines. Everybody's had COVID. Everyone knows somebody who had COVID. Many know someone who got injured from the vaccine or who has never felt the same since getting it. In fact, many of them don't feel the same. So I don't know. I don't think this campaign is going to do very well. I know British Columbia is about to roll out their fall vaccination campaign, so I'll be looking at that very closely. One thing I also know that's interesting is, many people, I think over 70% of Canadians get their news from One
Oh,
moment.
I think we're losing your audio there, Drea.
Oh, you
Sorry, it
lost
sounds a
me?
little bit like you're underwater.
Oh, okay. Well, I'll shut up now and you can go. I said enough.
Well, what I was just going to say though is again, you have to watch what they say. And so she says in this clip, it's expected to better protect, right? Not that it will. They seem to be kind of trying to distance themselves from the affirmative, safe and effective narrative. And they say things like it's expected to better protect. We don't really know, but it's expected to. So I guess get your shot and we'll find out. If it's been more than 6 months, you better be rolling up your sleeves, because I thought we were sold on the fact that those originals and then the Omicron specific booster was safe and effective, right? The whole point about being effective was that it would prevent infection and spread. And we see that that's not even possible. And I mean, the reference to pregnant people in and of itself is just laughable, because anybody who knows anything about biology and science knows that only women with uteruses can get pregnant.
Yes. And pregnant, and breastfeeding moms alone with these experimental jabs that we've covered many times, they knew nothing about their, how effective they were, and they were not safe, not even for the rats. So leave these pregnant women alone. My goodness.
The wellness company's Spike Support Formula is an all-natural supplement to help the people experiencing effects from COVID and the you-know-what. Go to twccanada.health/rebel today.